So, what exactly are polynucleotides?
So polynucleotides are these purified DNA fragments that are derived from the sperm cells of salmon and trout. Now, I know that sounds obviously quite funny.
What?
Welcome to episode 1 of In Clinic. I'm your host, Dinal, registered pharmacist and lead aesthetic practitioner at Clinic 1 Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic 1.
On today's episode, we're going to be discussing the use of polynucleotides. Now, this is an interesting treatment that's seen a large uptake across a lot of clinics lately, and it's quickly becoming the gold standard for regenerative skin injectable treatments.
So, what exactly are polynucleotides?
So polynucleotides are these purified DNA fragments that are derived from the sperm cells of salmon and trout. Now, I know that sounds obviously quite funny, but they're made to really good manufacturing standards. So they're basically void of any like fish protein derivatives. So this has been proven in studies that have been conducted on patients who have got severe fish allergies where they've been injected with polynucleotides and they exhibited no allergic response whatsoever. So the products are made to a stringent manufacturing process and they're pretty safe for near enough any patient who undergoes treatment.
So, how do these purified fragments of DNA actually work when we inject them?
So polynucleotides, when we inject them into the skin, they stimulate these specialized cells known as fibroblast cells to produce collagen and elastin. And these are two proteins that are really important in the skin for maintaining skin structure and elasticity, basically. So it does this by facilitating the binding of a molecule known as adenosine to receptors on the surface of these fibroblast cells, which initiates this process of them producing collagen and elastin. It also promotes what we call angiogenesis, which is the formation of new blood vessels, as well as stimulating growth factors, which all aid in tissue healing and regeneration. On top of this, they're able to scavenge free radicals and induce the production of these antioxidant enzymes, which basically protect DNA, protein and lipid structures in the skin from damage. And finally, they've got strong anti-inflammatory properties as well. So it's this like multifaceted mechanism of action that makes polynucleotides such an effective treatment.
So they really can do a lot. It's quite rare that you'll find treatments that work in so many different ways, isn't it?
It is, and that's why polynucleotides are one of my favourite treatments to perform. When I have a patient who's willing to adhere to the treatment protocol, by the end of it, they usually come away with some really good results that they can be really happy with.
So, what areas can be treated and how often does someone have to undergo this treatment to maintain their results?
So polynucleotides are a really versatile treatment and they can be used on loads of different areas of the body. One thing they're actually really good at, apart from improving like skin laxity and skin appearance on areas around the face, for example, they're really good at treating stretch marks and hypertrophic scars. So if somebody has those two issues and they're concerned about them, then polynucleotides is a great treatment for that. But the standard treatment protocol recommends 3 treatments spaced 4 weeks apart, and then a maintenance treatment every 4 to 6 months. But after the first treatments, results will typically become visible within sort of 6 to 8 weeks.
So, what is the downtime like for polynucleotides? There's always this big thing about lunchtime appointments where people can go on a lunch break to the clinic, come back to the office within an hour. Is this the same for polynucleotides as well?
Well, treatment duration varies depending on the area that's being treated. So if it's a small inconspicuous area, then it can usually be treated within 30 to 45 minutes. So, it allows for a quick resume to daily activities. But in an area, say, for example, like the tear troughs or the under eye, where there's not a lot of volume and the skin's quite thin, it can lead to quite a lot of swelling. Now, this is because of the formulation of polynucleotide treatments. It's essentially like a watery saline kind of consistency. So you can imagine if you're injecting that underneath the skin, it probably is going to lead to quite a bit of swelling. So in areas like that, there is a little bit more downtime. So it's not really going to be one of those treatments where you can kind of have it done and then go back to the office without anybody noticing. But there are other areas of the body where, if it's covered up, you have the treatment done, it might take 45 minutes and you can just go about your life as normal after that.
So you said that it's safe for the vast majority of people. Is there anyone that can't undergo the treatment?
So polynucleotide treatments are generally safe for pretty much anybody, but there are a few instances, as with all aesthetics treatments, where it'd be what we call contraindicated, which means you shouldn't really treat that person. So for example, in the case of pregnancy and breastfeeding, there's just not enough data out there for us to be certain that polynucleotide treatment is absolutely unequivocally safe for those patients. So we want to avoid treating somebody who's pregnant or is breastfeeding. As well, if somebody's got an acute infection or a chronic infection in or around the area that we're treating, we want to avoid that as well, just to prevent any further complications. Also, if somebody's immunosuppressed or immunocompromised, so in the case of malignancy, which is cancer, we'd want to probably avoid treating those patients as well. It kind of depends how unwell they are at the time. If the disease is quite under control and the patient's doing well and they're quite okay, then you could probably go ahead with treatment. But if the patient's really unwell and they're immunocompromised or immunosuppressed, you'd want to avoid treating those kind of patients. Generally, the treatment is very, very safe and very well tolerated for most people.
Is there any other treatments that could be combined with polynucleotides?
So there are other treatments that can be combined with polynucleotides to give a better result. So things like dermal filler, skin boosters, anti-wrinkle injections, things along those lines. What I always recommend is that people book themselves in for a consultation so I can have a look at their requirements really and build a bespoke treatment package around what their skin needs the most. The reason for this is that everybody's skin and face is obviously so different that what approach I might take for one patient may not be the approach that I take for another. So if you'd like to book a consultation or have a look at our treatment guide to learn more about the treatments that we offer, you can hit the link that'll take you directly to our link tree where you can find our WhatsApp number, where you can give us a call or send us a message to book your consultation. And you can find a link to download our treatment guide there as well, which will give you a lot more information about the treatments that we offer and answer some of the frequently asked questions.
Don't forget to like and subscribe if you've enjoyed watching today's show. Hit the bell if you're watching on YouTube to get notified when the next episode is out, and leave a comment if you have anything interesting to say. Thank you for watching.